Good morning, travelers, pre-med students, and undergraduates. Welcome to Doctor's Inn. This is where medical experiences are shared, study strategies are examined, and life lessons with a sprinkle of advice and habits are served. So, you specialize in minimally invasive procedures like bunions and hammer toes, for bunions and hammer toes. So are these surgeries mostly functional or can they be cosmetic as well?
Most of the times people, when they ask for MIS or minimally invasive surgery, is purely cosmetic, okay? I tend to give patients both options. I tell them, hey, these are the options. We can do this minimally invasive. Here are the pros and cons. Or we can do this the traditional, more open procedure. And I kind of let the patient weigh in on which decision or which route they would like to go through. There's no wrong answer, but yeah, I think when you explain to the patient the whole picture, they better understand what it is going forward. I always tell my patients surgery is a team, right? Like I can do the operation for you, but once it's done, I have to tag you in. You have to be compliant with not getting it wet, not walking on it, things of that nature. So I try to educate my patient as much as I can on the procedures, the risks, the benefits of all options before I even go into surgery. I find that this is probably the best way.
Perfect. Yeah, I mean, transparency is key. You said you obviously work with athletes because I believe even sprained ankles are one of the most common injuries in athletes.
Yeah.
So do you have a different consultation with them considering they have to be back on track and physical as soon as possible?
Yeah, athletes are very unique patients to treat. And the thing is, no two athletes are the same. You're not going to treat a 300-pound linebacker the same way you treat a 160-pound point guard, right? But with athletes, you kind of have to beat into their heads that the goal is longevity, right? Like the goal shouldn't be what am I going to do tomorrow? The goal is I want to be healthy for the rest of my career. And the biggest mistake you can make is rushing people back into activity before they're healed. So I still treat them the same way I would treat the normal population going through injury. Okay, there are certain scenarios where maybe you might be more aggressive with athletes, like Achilles ruptures and things like that. The more aggressive protocol with athletes tends to be the rehab phase, right? So now they're healed. How do we get them back 100% before they get on the field, the court, or wherever their specialty lies? And that you have to call in your colleagues in physical therapy. With athletes, I work pretty much hand in hand with the physical therapists in my neighborhood because I need them.
Right.
I need them. I can diagnose the patient, I can treat the patient, but when it comes to the rehabilitation aspect of it and prevention of the injury from rehappening, I need my physical therapist to come and play. So they play a big role in my practice.